we've got a 35-year-old man that presents to the GP. He's got a 2-month history of pain, stiffness on the right knee. He's got a sticky discharge from the eyes. The patient complains of a burning sensation when he passes urine and a discharge from the penis. He regularly has unprotected sexual intercourse, and the affected joints are tender and swollen. Which of the following is a poor prognostic factor under the various conditions? Which is the worst prognostic factor in this? The question is, do you know the condition firstly? Do you know the condition? If you know the condition, then do you know the risk factor and the prognostic factor for this particular condition? Give you another couple more seconds to guess. If you've guessed answer A, which is age of disease onset less than 16, you'd be correct. Let's go through this now. So the key question is, what is the diagnosis? The answer is, if you know already, well done. It is reactive arthritis. This is Rita's syndrome, okay? This is consistent with the reactive arthritis, Rita's syndrome. This is a triad of asymmetrical oligoarthritis, mainly involving the lower extremities. You've got conjunctivitis. You've got urethritis as well. So can't see, can't pee, can't climb a tree is what they normally say in terms of a triad, okay? So this is the 3 components there. And also we've got risk factors: engaging in unprotected sexual intercourse. This is a risk factor for developing and getting chlamydia infection, which is a common trigger for reactive arthritis. So why is A the most important prognostic factor then out of the ones listed? Because obviously reactive arthritis is more common in ages of 20 to 40, but if someone's young, below the age of 16, then it's much more severe course, worse prognosis, okay? Juvenile onset reactive arthritis, much more aggressive, high likelihood of chronic symptoms, and also the other issues. And these are patients who need early initiation of DMARD drugs or biological agents as well. So what about ankle involvement? So obviously reactive arthritis can affect an ankle joint, is much more common in the lower limbs. It doesn't necessarily mean it's a poor prognosis. However, if the reactive arthritis involves the sacroiliac joints, the lumbar spine, that's going to more likely indicate something worse in terms of treatment-resistant chronic course of disease. Female sex is incorrect because it's in and of by itself not considered a poor prognostic factor. However, females can develop ongoing chronic symptoms more. Rheumatoid positivity is incorrect as well, because that's normally associated with rheumatoid arthritis. And unresponsive to paracetamol is incorrect too. Paracetamol is just a mild analgesic, and obviously anti-inflammatory drugs are the first line treatment for reactive arthritis.